Actually, neurocutaneous syndromes are my favorite. These are disorders in which the nervous system and the skin is affected. There are five major syndromes. The common thing among all these five are all are inherited except for Sturge-Weber syndrome, which is not inherited apparently. One of the most common manifestations is the tendency to form benign and sometimes malignant tumors in various parts of the body. So, like these syndromes will form cancer as well. Let's start. First one is neurofibromatosis. It is the most common among all the five things. So, it is autosomal dominant inheritance, highly variable penetration, and it's of two types, NF1 and NF2. NF1 is von Reckling-Austen disease, chromosome number 17. Well, the gene for neurofibromatosis 2 is located in the chromosome 22. NF1 is diagnosed in the presence of 7 clinical features. First one is cafe au lait spots. Second is first is cafe au lait spots. Second is neurofibromas. Third is axillary flecking. Fourth is optic glioma. Fifth is hematoma in the iris called the Lisch nodule. Sixth is osseous lesions. Seventh is a first degree relative with NF1. So we need at least two of the 7 features to diagnose neurofibromatosis. So let's see in detail about the diagnostic features. 6 cafe au lait spots. So about the cafe au lait spots, 6 cafe au lait spots should be there. The size should be more than 5 millimeters in case of prepubertal children, and it should be more than 15 millimeters in case of postpubertal children. So the number of cafe au lait spots is 6, size is 5 millimeter cutoff for prepubertal, 15 millimeter cutoff for postpubertal. And about neurofibroma, there should be 2 or more neurofibromas or at least one plexiform neurofibroma. Okay, and then third is axillary freckling, fourth optic glioma. Fifth one is hematoma, the Lisch nodules in the iris. 2 or more Lisch iris nodules should be there. Sixth one is osseous lesions such as sphenoid dysplasia or thinning of long bones. Sphenoid dysplasia, thinning of long bones. Okay, that is osseous lesion. Then a first degree relative. Nervous system abnormalities include optic glioma, intraspinal neurofibroma, aqueductal stenosis, dural ectasia, MRI findings of increased signal in the basal ganglia, cerebellum, brainstem, subcortical white matter. Okay, a lot of stuff. The main thing is aqueductal stenosis. According to me, I think that's the most important one in case of either. And then MRI, there is increased intensity in the basal ganglia. I think that's the most important thing. In the basal ganglia, not just that, in the basal ganglia, in the brainstem, the cerebellum, and the subcortical white matter. Okay, just remember basal ganglia and cerebellum, okay? Yep, that's about neurofibromatosis. Moving on to Sturge-Weber syndrome. A facial nevus or a port wine stain in the distribution of the first branch of the trigeminal nerve is associated with ipsilateral railroad pattern of intracranial calcification. So like you take a picture of the brain like x-ray or something, you're gonna look at a train track. It's a railroad, okay? You see train going in there. Okay, I'm just kidding, there's no train going in there. Ipsilateral railroad pattern. Portwine stained face, and then in the brain there's this railroad. And you look at the eye, the child has glaucoma. Presentation is with contralateral hemiparesis, focal seizures, intellectual disability. Control of seizures may need surgery. Monitoring for glaucoma is necessary. Tuberous sclerosis complex. So we have the TSC gene, tuberous sclerosis complex, 9q34 for TSC1. TSC2 is 16p13.3. It's autosomal dominant, developmental delay, intellectual disability, autism, seizures, subependymal nodules, cortical tubers are all seen in tuberous sclerosis. The subependymal nodules undergo malignant transformation to form glial tumors. Skin shows ash leaf macule, adenoma sebaceum, cafe au lait spots, shagreen patches. Kidneys show angiomyolipomas, lungs show lymphangiomyomatosis, heart rhabdomyoma, retina hematoma. Symptomatic treatment, anticonvulsant necessary. Other organ tumors should be treated. Thank you.